Hello everyone, myself Dr. Vaibhavi Iyer, Registrar under Dr. Niranjan Chavan unit. Today we'll be talking about the instrument and the procedure of internal iliac artery ligation using Chavan's internal iliac artery ligation forceps, an innovative instrument designed by Dr. Niranjan Chavan, Professor and Unit Chief at Lokmanya Tilak Municipal Medical College and Science Hospital, Mumbai, India. Before learning about the surgical instrument and the procedure of internal iliac artery ligation, we should learn about the relevant anatomy related to the internal iliac artery.
Now let us discuss the anatomy of the internal iliac artery. The abdominal aorta descends down at the level of the L4 and L5 vertebra. It divides into two major branches, which is the right common iliac artery and the left common iliac artery. The common iliac artery at the level of the lumbosacral junction divides into two major branches, which is the external iliac artery and the internal iliac artery. The external iliac artery traverses along the pelvic beam before supplying the lower limb, whereas the internal iliac artery traverses for 3 to 4 centimeters down before dividing into its two major branches, which is the posterior division and the anterior division. Let us discuss the anatomical associations of the internal iliac artery. The ureter, most critical structures, lies anteriorly to the bifurcation of the common iliac artery and runs throughout the course of the internal iliac artery. Posteriorly, it is associated with the lumbosacral trunk and the internal iliac vein. Laterally, it is associated with the external iliac vein, and medially, it is associated with the pelvic viscera.
Hello, myself Dr. Hemant Kadam, registered under Dr. Niranjan Chavan. I will be describing the parts of the Dr. Chavan internal iliac artery ligation forceps. So, starting with the handling end, which has two rings to accommodate the rings finger of the surgeon, which has a stop, it has a ratchet, and it has a box joint. And this is the business end, which has a curved tip, and this curved tip has two eye openings to accommodate the two suture material simultaneously and separate. This video demonstrates passage of the ligatures through two eyes of the instruments separately, and it facilitates minimal handling of the artery and single use during ligation.
Hello everyone. This is Dr. Deepika Ravi, Registrar under Dr. Niranjan Chavan, and I will now be explaining the procedure of the internal iliac artery ligation. After gaining adequate abdominal exposure, the uterus is retracted medially, and the most prominent structure, that is the round ligament, is identified. The posterior leaf of broad ligament is dissected, overlying the iliac vessels parallel to the infundibulopelvic ligament to expose the retroperitoneum. As the retroperitoneum is opened, this is our view. This is the cephalic end of the patient, and this is the caudal end of the patient. This procedure is being done on the left side of the patient. The psoas major muscle is visible on the floor of the dissection. Running across it is the ureter, which can be identified as the glistening white tubular structure. The ureter is carefully identified and retracted medially throughout the procedure. The external iliac artery is identified as it lies on the psoas muscle and traverses towards the inguinal ligament. The dissection is then extended proximally to identify the common iliac artery bifurcation. This bifurcation is the most important landmark in the procedure. The internal iliac artery is followed for approximately 3 to 4 centimeters into the pelvis. At this stage, care is taken to identify the internal iliac vein, which lies slightly posterior and medial to the artery. Injury to this vein can cause torrential hemorrhage during the procedure. Two sutures are loaded into the distal two eyes of the instrument. The curved arm is slid below the anterior division of the internal iliac artery from the lateral to the medial side. This arm is then withdrawn so that the ligatures automatically get placed below the vessel. Following the withdrawal, the ligatures are placed 1 centimeter apart and secured. The advantage of using the Chavan's internal iliac artery ligation forceps is that two sutures can be placed at the same time, thus reducing repetitive insertion and withdrawal during the procedure. This is the post-procedure image.
Chavan's internal iliac artery ligation forceps is a specially designed instrument that facilitates safe and rapid ligation of the anterior division of the internal iliac artery, particularly in situations of severe pelvic hemorrhage. Its main uses are control of postpartum hemorrhage, like in atonic PPH not responding to the medical management, traumatic PPH with severe persistent pelvic bleeding, PPH associated with coagulopathy where rapid vascular control is required, placenta accreta spectrum disorders, obstetric hemorrhage like uterine rupture, broad ligament hematoma, and uncontrolled bleeding during cesarean section.